Contexture is a regional health information exchange and healthcare data utility in Arizona and Colorado. So we support providers in having access to data, healthcare data, social care data, so that they can make decisions about the healthcare that they provide. I previously was a case manager, and so I supported organizations and folks connecting to resources. And through that work, I really needed a tool like Unite Us. I then learned about the closed loop functionality of Unite Us, and I was able to utilize it as a caseworker previously. When I started this role at Contexture, we were partnering with Unite Us to implement a closed loop referral system across the state of Arizona, and it's been so impactful to see the statewide rollout, the availability of resources, and then the functionality and the technology that Unite Us provides. We work very closely with Unite Us in Arizona. We meet regularly with them. We are implementing a statewide closed loop referral system across the entire state of Arizona that is sponsored by the state Medicaid agency. So we are working on implementation, onboarding organizations. We are out in the community doing community engagement and outreach, and really just trying to understand what are the community level needs and how can we show up to support and offer solutions that really help those communities meet their goals. The best impact or where we've seen our greatest impact is by being out in community, engaging, again, understanding their needs, and then trying to figure out together with community members, with the community-based organizations, how we can implement a workflow that will support them in their goals. In Arizona, the state Medicaid agency, which is ACCESS, which stands for Arizona Health Care Containment System, offers the Differential Adjusted Payment Program, or DAP. And the DAP program reimburses providers who are participating in the different DAP milestones. So, for example, one of the milestones is around social determinants of health. Participants who are enrolled in the SDOH DAP program receive an increased reimbursement for all of their Medicaid claims. They have to, of course, meet the milestones of the programs, which include utilizing Unite Us through the Community Cares program in Arizona to screen for social care needs for patients and then providing an intervention and connection to resources. Unite Us is the technology solution that powers the Community Cares program in Arizona for providers who are enrolled in the SDOH DAP program. They are agreeing to utilize and implement Community Cares to send closed loop referrals for their patients. What they are doing, therefore, is using the Prepare tool directly within the platform, and then screening for the social care needs. The tool will then help to recommend resources that are available within the community and then send those referrals. So through this connection and partnership, Community Cares and the Unite Us platform are supporting providers in not only receiving those reimbursements, which are super critical, of course, to their operational costs, but they can trust that their patients' needs are going to be met.